We're here at the Spears Creek Veterinary Clinic in Columbia. We've got our guest, Dr. King. Dr. King has been a vet for 24 years, and she's been the pet expert for our local news station, WIS-TV, for the past 9 years. So we're really excited to be here to be able to get her expertise and hear from her why she uses Redeem CBD and hopefully answer any questions that you guys have. So, Dr. King, how have things changed for you as a vet in the past 24 years?
Well, medicine is always changing. That's why we call it practice. But I guess in relations to the CBD, and a lot of people want to do more natural type of therapies. And so I find clients really kind of reaching for the more natural stuff like CBD.
Okay.
So I mean, it's coming. People are asking for it, so we have to provide it for them.
And what has been your experience with the CBD, and what has been the overall perspective of the people you've given it to?
Well, I think it's fantastic. It works really well, and I was going to go over a whole bunch of different things that CBD actually does. But I have a lot of people very much so embracing it. And especially the pet oil, because it's bacon flavored. They like the bacon flavored. Yeah, it's yummy.
So what for you made you, because a lot of vets aren't recommending CBD right now or just don't know much about it. So what made you specifically say, okay, we're going to offer this here when it's so controversial?
So I went to a seminar, and there were 800 veterinarians in this one room learning about CBD. So it's coming. It's a little bit edgy, but there's so much science behind it. Crazy good science behind how the CBD works, and I was going to touch on it just a little bit, but that's kind of why I got into it. Is I really feel like it has benefits, and my clients feel like it too. They keep coming back for more. So it's super worth it.
Cool. And you were saying earlier about antibiotics.
I'm not a fan of antibiotics anymore, just because it kills your gut, and your gut is part of your immune system, and the bacteria in there, your whole microbiome, is so important to make healthy. And we're killing them with using antibiotics, so I get away from antibiotics now. If there's a skin infection or something, I might use a topical instead of an oral antibiotic.
Gotcha.
Mm-hmm.
Well, why don't you go ahead and start talking about some of the things you wanted to share as far as the science behind it.
Okay, well, I wanted to at least say why I chose the company Redeem, because they are local. They're from Lugoff, South Carolina, which you guys know I'm a local girl. And it's pretty neat. They get their hemp from North Carolina, and the hemp is organic too. So none of those yucky stuff in it. And what's really neat is every single bottle of it has this, it has one of the little QR codes on it, and you can put your phone app on it. So what's really neat about this is that every single lot gets tested by a third-party company. That means they send it out to somebody else to say, hey, tell us that we really are doing a good job putting the right amount of CBD in there, but also that there's no THC in there. That's the part that has the psychotropic effects of it, and you don't want that, and that's the part that's illegal. So this paper is telling you that this is something that you can legally have and not get in trouble for it. So very important, this third-party paper that they do for every single lot that Redeem makes.
And just to touch on that and clarify, there's a legal limit of THC that you can have in certain CBD products. So you've got full spectrum or broad spectrum. And for the pets, we're doing full spectrum because they don't have to worry about getting drug tested. But every CBD product works better in combination with all of the natural compounds in the hemp plant. So that's why we recommend having at least a little bit of THC. So it's under 0.3%, which is the legal limit.
The legal limit, yeah. Right, exactly. That's the legal limit. All right, so what I was going to touch on is a little bit of how it works. Now, it's called the endocannabinoid receptors. And that's the only time I'm going to say that, because that's just too big of a word and it's a tongue twister. All right, so we're going to call it CBD. And so the CBD binds with these receptors in mammal brains, okay? It's called CB1 and CB2, which is really cool. If you think about it, we have receptors in our brains, dogs' brains, cats' brains, that are binding with this right here. So obviously we have evolved to have this be important in our system. So I feel like it's meant to be for us to use these products. If our brain says it's okay, it's probably okay. What's really neat about this system is it's for like homeostasis, big word, but what it means is normal. This is going to bring us back to normal. And there's so many different uses for it. Let me set this down. So many different uses for it. So I wanted to go over some. So neurologic pain. So if you can bring me Charlie here, right here. This is Charlie. Charlie's a little dachshund, and Charlie slipped a disc this week, and he went down and he was paralyzed in his back end. And it's painful when they slip a disc. It pinches the spinal cord, and it's inflammatory. So Charlie got, among other things, he got CBD, and he is doing fantastic. He's actually up and walking already, and it's only been from Monday. So really, really, really well. Really good response.
So how long would it normally, like, what would you expect?
Sometimes up to 6 weeks. Sometimes up to 6 weeks. So he has done fantastic.
Awesome, Charlie. Good job. I'm glad you're doing
All right, here.
Easy. So cute.
All right. So the other thing that it works really well with is anxiety. I thought about it and I said, okay, everybody's out there. Y'all are probably watching me instead of the inauguration because you're anxious about it. So what I thought is maybe I can help you guys. Let me open this up. I'm gonna give you a little dose right here. So now it works best if you put it under your tongue. So I need you to open up your mouth. Okay, that's good. All right, I'm gonna give you a little dose right here. Oh, that's perfect. All right. It's about 10-15 minutes after we're done. You can go watch that inauguration and you'll feel much better. It's not going to give you a high. It's just going to make you less anxious. So I love it for anxiety. I do a lot of rescue work, and the foster dogs are always anxious because they're in a new home or a new environment. And I find that they do really, really well to get it. Now, you can give it every day, or you can just give it if they're, say, going to the vet clinic for the day and they're nervous. You can give it to them beforehand. It lasts about 3 to 4 hours. 3 to 4 hours is how long you get out of a dose of it.
Well, how would you explain or describe anxiety in pets? What are the symptoms?
Oh, you can definitely see it. They shiver, they shake, they hide under the owners when they get here, when they're scared. They might vocalize. There's lots of different things, but you can just look in their eyes and see that some of them are terrified. And some, it's kind of like people. There's some people that just have anxiety in general all the time, and those are the ones that are going to need the CBD all the time, as opposed to some animals, it's just in certain environments where they're nervous about it. So I do have a patient around here that has epilepsy. He's supposed to be around here so that I can. Is Scout available? So epilepsy is pretty neat. So no, it's not neat. CBD with epilepsy is really neat. They are actually doing a study, and I want to say it might be at Cornell University right now, in pets to treat them, the breakout seizure ones, the ones that you give them the classic anti-seizure medications and they still are having seizures. So they're doing a study, they're adding CBD to that to see how they're doing. So a little Scout right here. So Scout's a little epileptic too, and the epileptic, that just means that they have seizures. We don't know what causes the seizures. It's a electrical overflow in the brain, and they're short, sweet, and to the point. But little Scout here has seizures, but they are well controlled, and he does really good. And he likes his little CBD. He likes his little bacon flavored CBD all the time. So he does really, really well. Anti-inflammatory. So it's really good as an anti-inflammatory. So anything arthritis, anything inflamed, it's fantastic for anti-inflammatory. I use it a lot for that. Glaucoma, pretty neat. That one's I haven't used it for glaucoma yet, but it reduces the intraocular pressure, so it can help slow down the progression of glaucoma pretty neat.
There have been a lot of studies with humans too that show CBD in combination with certain medications. Now, it can interfere with certain medications, so you talk to a doctor or a vet first, but it can enhance the effects of those pills or medications.
It's almost like a synergistic thing. Yeah, there are a lot of information about it being anti-cancer. It's not FDA approved for this. It does not treat it, but a lot of people use it if they do get cancer. Use it a lot in some of my patients that there's not a whole bunch else that we could do. So at least you feel like you're doing something that's bacon flavored. They get a treat every day. And when I keep talking about the bacon flavored, a lot of people want to treat with CBD in it because they just want to feed it to the dog. The problem is if you feed it and they swallow it, it gets digested, so it doesn't work as well. So you would have to, the bioavailability is just, it doesn't absorb as much. So you would have to use almost, I want to say it's like 30 times the dose if you're doing treat form. So you really have to do it. You have to put it under the tongue, transmucosal, in the mouth. And one way that I like to do it is we have these little flat rawhide treats around here. And the dogs love to chew on them, and they chew on them for a long time. So you can actually pour it on the treat, the amount that they need. And that way they're chewing and they're putting it in their mouth. Some dogs just really like it and they'll lick it, but you're really aiming for the mouth, not down the gut.
Yeah, because when it's in your mouth, just like humans, dogs are the same way. You have the the salivatory glands. And it just absorbs the CBD faster and more effectively, whereas when it comes into your digestion, it gets attacked and broken down, and it's something, like she said, like 30% difference. So you just want to give them more if you have to feed them that way. And one thing I want to say about that too, with this, we've repackaged our oil for dogs. So now you just get one and you can dose it for different sizes versus buying different products for different sized animals.
And that doser is on the dropper itself.
It's on the dropper. You can see it, and it tells you exactly, for what weight, which level, how many milliliters you want to give a dog. But we use a plastic dropper now. It used to be glass because so many people, you have to put it in their mouth for the most effectiveness. And just in case you have a chomper, we don't want any glass breaking in their mouth. So with this new one, it's all plastic, just to avoid any fears with that.
It's nice packaging. I love their packaging. Two more, it's an appetite stimulant. So when you have some of these really sickies that aren't feeling good, and maybe cancer's got them down, or maybe kidney failure or something like that, where they're not eating very well. And it kind of goes hand in hand with, it's an anti-nausea as well. So it's making them not as nauseous, then they're more likely to eat, and they do better if they're eating, obviously, instead of starving themselves to death.
Yeah.
So that's kind of my summary of what CBD does and how many places that we can use it in a veterinary setting. It just is, it's a little bit miraculous, but I think it goes back to these two receptors. They're in our brain, and they're just bringing us back to normal. So if your dog has seizures, then it stops the seizures. If it has anxiety, then it stops the anxiety. If it has inflammation, it brings it all back to the center, back to normal. And it does it through these receptors in the brain that we've all got, and all of our pets have it. Those receptors are there for a reason. Do we want to put it out for comments, or do you have something else?
I don't see any comments, so I don't.
We do have viewers, though. Where are you guys at?
They're watching, but I think hopefully that means we answered all their questions. But,
or are we shy?
This is a recording too, so if you're watching this back, feel free to leave comments, because like I said, this is going to be a series. We're going to do another video with Dr. King in the future, so we can address any questions that we didn't address now. And you guys, come see Dr. King at Spears Creek Veterinary Clinic. It's on Spears Creek Road, in South Carolina, which is Northeast Columbia. She knows her stuff about pets in general, but when it comes to CBD too, if you're in South Carolina, you want to come see her, because she clearly is.
She's very passionate
expert
about giving your pet the best care possible.
Oh, and I got the best staff in the whole wide world.
You do have a great staff.
It's fun here. They're nice. Well, thank you so much.
You're welcome.
This was
You're
fun.
welcome.
Okay. Bye.
Bye.
Bye, guys.